Hi everybody, welcome back to the Dr. Sia channel. In today's video, we're going to be talking about how people who have an ambivalent attachment are affected by COVID-19. I sort of had a video about avoidant attachment and COVID-19 that I posted way back, and it's been resonated so well with people in the community that I thought, well, time to do the other attachments. Well, let's get started. All right, so in general, people with an ambivalent attachment, the way that they're affected by COVID-19 goes really two different ways. There are those who are affected by COVID-19 in the sense that they will get overwhelmed. And this is always a feature of ambivalent attachment. When you have an ambivalent attachment, this sensation that you'll be overwhelmed with anxiety is right around the corner. And what would give a person more anxiety than an international pandemic? So people who have an ambivalent attachment will find themselves getting overly anxious and needing to rely on partners, on coworkers, on friends, on family members to deal with that overly anxious experience that they have. They'll be really worried and they'll be making some really rash decisions in terms of how to deal with that worry. So they might find themselves very quickly wanting to deal with any possibility that their mind, their worry tells them might happen. So if their worry tells them that they need job security because they're going to lose their job, you might find them very quickly looking for more jobs, very quickly trying to secure themselves in that sense that they will always be worried and anxious about the possible outcomes of COVID-19. So that's one way that people who have ambivalent attachment could be experiencing the pressures of COVID-19. Now, there's another way that it could go as well with ambivalent attachment, and I think that this is where a lot of people with an ambivalent attachment then believe that perhaps they have an avoidant attachment, which is, for a lot of people with ambivalent attachment, deep down inside, a really big difficulty is pursuing their own wants. And they tend to other people's shoulds, other people's oughts, and what other people in general tell them to do. But for some people with an ambivalent attachment now, they'll be relieved. They'll be relieved in the sense that they can't really do the things that people tell them to do, that people tell them they ought to do or that they should do, because hey, there's COVID-19. In a sense, for some, they'll be relieved within themselves, not relieved about the fact that COVID-19 is happening, not that they want it to happen or that they're bad people in any way, they're not, but just this sense that within themselves, they'll find that they'll be relieved that there's this really big obstacle to them following their shoulds, so they'll just happily sit at home. For once, for a lot of people with an ambivalent attachment, they'll find that finally they have a reason to should away their other shoulds, so to speak. If people have told them, oh, you should study, you should study, you should study. Well, now that COVID-19 is happening, studying is really hard and it's objectively very hard for everybody. So I get to finally do what I wanted to do, which is I get to sit at home and do the drawings that I wanted to do or whatever. In this sense, there are really two big opposite directions that people with ambivalent attachment go at the moment. They either go towards becoming overly worried, overly anxious, overly concerned, or they go to being quite relieved about the fact that COVID-19 allows them to sit quite reliably and relaxed within themselves, knowing that they can reliably just tell other people that, yeah, I know these are things I should do, but you know what, COVID-19. Now, what can we do about that? That's a really important bit. So with therapy like ISTDP, we can help a person reduce their anxieties, their sort of overly anxious tendencies to worry about the things that are not really happening, and help them work towards their wants more, such that they don't need an international pandemic to be able to rely more on what they want, to be able to pursue more of their own wants. In that sense, they can pursue their own wants whether there is a pandemic or not. And in that way, be more confident within themselves as human beings that they can and are allowed to, and indeed, if they have any should, is the should of looking at their own wants as opposed to what other people tell them they ought to or should do. I hope this video was helpful for you. I hope you learned some ways about ambivalent attachment and how it's affected by COVID-19. Of course, these are not the only ways that people who have an ambivalent attachment are affected by COVID-19. If you have other ways and other things, thoughts that you have about how they might be affected, drop a comment down below. And please do subscribe to my channel. I can't emphasize enough how helpful that would be to me. And it's so easy for you. It's just go click on that bell button, go click on that subscribe button. It really does help me a lot here in this channel and the things that I'm trying to do. So your support is very much appreciated. Also, check me out on Insta on @DrSia, where I post a lot about the different attachment styles, about ISTDP, and about psychotherapy. As per usual, I'll see you next time. Bye-bye. Wait. Yeah.